Okay, so first we're going to talk about the basics of urination. I always tell patients that in order for urination to proceed properly, the prostate has to be working properly, but also the bladder has to be able to work properly, which means that as the bladder is filling, the nerves in the bladder have to sense when the bladder is full and send that message up the spinal cord to the brain. The brain and the spinal cord also have to work to tell the bladder to empty. The bladder itself is a muscular bag like a pump, and it has to be able to have the strength to squeeze. And once the bladder starts emptying, urine flows out the bladder outlet, down the urethra, and out the penis. And the prostate sits like a donut around the urethra at the base of the bladder. And unfortunately, as we get older, for most of us, the prostate just kind of gets bigger and bigger, just kind of part of aging. And as it gets bigger, it's not so much the size that matters, but how much it gets tight in the center, because it'll often squeeze on the urethra like a blood pressure cuff, and that can cause problems with urination. There are a lot of other things, though, that can overlap with some of the symptoms of BPH, namely things like urgency, frequency, and nocturia, or getting up at night. So some of those things can be a result of other problems apart from BPH. In other words, you can have an overactive bladder, which is a very common thing that both men and women get as we get older. It can cause the bladder to kind of want to squeeze and empty more frequently than normal. You can also have things like stones or urinary infections that can also cause these symptoms. So like I was saying before, it's really important to understand, one, that the problem that we're treating is indeed BPH and not some other bladder issue. It's also important to understand that these things can coexist. You can have an enlarged prostate and an overactive bladder, and that's not really a problem. We can still treat the prostate, and then if you do have an overactive bladder afterwards, we can kind of work on that. But it's also important to understand for patients who have perhaps spinal cord injuries, other kind of neurological problems, or patients who have just been struggling with BPH for a long time, and the bladder gets really stretched and just kind of stops working. Any of those patients may not have a good result after a prostate artery embolization procedure, or any BPH procedure for that matter. And so it's important, one, to figure that out beforehand, and two, to have realistic expectations about how much any kind of prostate procedure is going to help a patient with improvement in their urination. When we're evaluating a patient for BPH, we'll look at a few things. One, we'll look at what's called the IPSS, the International Prostate Symptom Score, which asks the patient a bunch of questions about how bad their symptoms are. It gives you a total score of 0 to 35. If your score is 0 to 7, your symptoms are in the mild range. If your score is 8 to 19, your symptoms are in the medium range. And if your score is 20 to 35, that puts you in the severe range. We'll also look at your gland size, and we'll look at what's called a post-void residual, the PVR, which tells us how much urine is left in your bladder after you tried to urinate. Lots of times we'll also get an imaging study like a CT or MRI to look at the anatomy and make sure we're not missing something that might look like a prostate cancer. Lots of times urologists will also put a scope up the urethra and the bladder to take a look around and make sure we're not missing some other problem, or also to look at the size and shape of the gland with respect to the surgeries they might do. Typically, if a patient has blood in the urine, commonly it's related to a big prostate, but they also have to take a look in there to make sure they're not missing something else like a cancer or stones. Oftentimes we'll get a PSA level, which just kind of is a measurement of a blood level looking for possible prostate cancer. And that pretty much concludes the workup.